Hello again, everybody. My name is Marty Guthmiller. I'm CEO of Orange City Area Health System, bringing you today on April 5th, 2021, the 99th edition of our COVID-19 community briefing. I have a brief briefing for today. There's not a lot to talk about, and that is good, but a couple important things. Generally, we'll go through the numbers here. And to give you a little bit of a spoiler alert, trending down or favorable a little bit locally, trending up a little bit on a statewide basis. So we'll get into the numbers right now, and we'll see. I'll give you the proof of that data. Our scoreboard is 1,959 positives here. Since the beginning of the 10,458 tested. More importantly, again, for the week, we've had 26 positives the last week of 177 tested. That is a 14.7% increase rate, which is down a little bit from 15.2% the week before. And again, that is just on the number of tests performed at Orange City Area Health System. Sioux County, the 14-day average is 5.4%. That's down from 6.1 a week ago and 6.1 2 weeks ago. 7-day average is 5.9%. That is down from 6.2% a week ago and 7.3% 2 weeks ago. So some nice trends in Sioux County. Region 3, kind of treading water, so to speak. Number of hospitalizations in the 20 counties in Northwest Iowa is 34. That number was 38, but it was 28 a week ago, or two weeks ago. So 34 this week, 38 a week ago, 28 2 weeks ago. There are 4 people in the ICU in Region 3. That has remained constant for the last 2 weeks. 2 of those patients are on ventilators. Iowa has a 14-day average of 4.9. That is slightly up from 4.5 a week ago and 4.0 2 weeks ago. The 7-day average, 5.1%, up from 4.9 and 1 week ago and up from 4.2 2 weeks ago. So not significant numbers in any regard, but generally speaking, up a little bit at the state level, down a little bit at the local level. In terms of hospitalizations, trending up over the last 3 weeks. 201 Iowans hospitalized somewhere with COVID. 192 a week ago, 174 2 weeks ago, and I believe it was in the 160 range 3 weeks ago. Sioux County currently has 0 residents hospitalized anywhere with COVID. A sure sign that this thing is not over were the number of additional deaths recorded this past week. The number is 5,822. That is up 97 from the last time we spoke. Now, again, I don't know that 97 people died in the last week, but that's when the numbers were reported. So those deaths could be from a previous period, but the death certificates are just coming through, particularly in this time. I don't know how that works exactly in terms of the timing, but nonetheless, it's not over. And that officially is all deaths related to COVID-19 is how the state records that. Sioux County has had 3 additional deaths attributed to it at 72. And that was previously 69. Again, on the demographic side of the equation, 93% of all deaths in Iowa are in the 60 and over age group, and that hasn't changed for months, for a long, long time. So those are the statistics that I have to share this morning. All in all, pretty consistent, all in all, pretty good. So let's shift over a little bit to vaccine and vaccination status. As of today, April 5, the vaccine is available to anyone. So Orange City Area Health System encourages everybody to get vaccinated. That is the one weapon that we have, probably the best weapon that we have in combating COVID-19 and in reaching herd immunity, which is the goal. We're encouraging everybody to sign up. And as of today, that can be truly everyone. We are, this week, have received a special allocation of 1,200 doses. And when I say we, I'm talking about Sioux County now, has received 1,200 doses of the Johnson & Johnson vaccine. We are not assured of any future allocation from Johnson & Johnson. This is a special allocation and a special allotment. It is not specifically for the general public. It is being allocated specifically for Northwestern, Dordt, and NCC. And we have those 1,200 doses for that. Those will be administered this week. And there's the potential for and likelihood of extra doses being available. So keep your eyes and ears tuned to social media and other outlets. If we do have extra capacity this week and you do want to avail yourself to the Johnson & Johnson single dose vaccine, there may be a possibility of that later this week. So, and by later, I'm probably meaning Friday. So we'll get some news out. Again, we would encourage you to sign up for that if that's something that you've been waiting for. But again, there's no future guarantee that we're going to be getting any more of the Johnson & Johnson vaccine. In terms of our wait list, we're in the low 200s. I think the number officially today was 237. That number is remaining fairly constant, even though we are receiving 170 Moderna doses each week. And so we continue to do that. We don't have any, haven't been reported to that we're going to be changing that allocation. So we are expecting 170 to continue to take care of basically a week at a time in terms of what our wait list is saying. So again, really encourage you to sign up. And again, we don't care where you get it. Hy-Vee and Walmart. I understand there's some occasional announcements in Walmart that says, attention shoppers. If you want the vaccine, we have some available. So if you're in Walmart and you haven't been vaccinated and you hear a attention shopper communication, consider getting it. That would be good. So Orange City Area Health System, certainly by the end of this week, we will be over 5,000 vaccinations given, counting the prime and booster doses. So we're making a dent. We are able to get all the vaccine that we received in people's arms, and are committed to continue to do that. So again, one final plea, we encourage you to sign up. And again, now anyone, anywhere can get signed up. So please do that. We may not be able to get to you immediately, but right now, certainly within a week, 2 weeks at the most, we should be able to get to everybody. So let us know. Again, call, go on our website, whatever avenue is easiest and best for you, please do that. In the meantime, this is not over. Continue to use common sense when you're out and about. Continue to use good hand hygiene. Those kinds of things that we've become way too used to at this point. So continue to do good social distancing when it's appropriate, and masking when you can't maintain the appropriate social distancing. So we appreciate everything that you've done in support of Orange City Area Health System, and continue to encourage your vigilance. Continue to wish you good health. So thanks again for joining us today.